my name is Anaya and I'll be teaching you the proper way to do an occupied bed and non-occupied bed. So first things first, you want to go ahead and do proper hand hygiene. It's important to do proper hand hygiene before coming in contact with a patient. Once your hands are fully clean and dried up, you want to go ahead and put on your gloves. The reason why it's important to put on gloves is because when changing bed sheets, you will come across urine or blood in the sheets, and you don't want to come in contact with your hands, so you want to be safe and put on your gloves. Okay, so once my gloves are on, in this case I don't have a real patient, so I'll be explaining to you guys what I will be doing to the best of my ability. I hope it's kind of clear. So before you walk in the room, you want to go ahead and check the care plan, and you want to make sure to know if your patient could assist themselves, and they could help you out with basic things, you know, like rolling over the bed, things like that, because some patients might not be able to. So in this case, my patient, he's able to assist himself just a bit, just for me to help him. So once you walk in the room, you want to make sure to introduce yourself to the patient, greet the patient, make them feel comfortable, you know. You want to provide privacy as well. When changing the bed sheets, you want to not try to expose the full body. Try to keep it, you know, you want to make the patient feel very comfortable and with the procedure, because it could be very uncomfortable to certain people just to change bed sheets. So you want to go ahead, like I said, introduce yourself. You know, for example, I'll walk in the room and say, "Hi, my name's Anai, and I'll be assisting you today. I'll be helping you out by changing your bed sheets today. And yeah, let's get started." So once you've done that, you want to go ahead, also identify the patient. You don't want to have the wrong patient. You want to make sure you use two identifiers. You want to ask the patient for their name and their birthday, and you want to confirm it with their bracelet. So now I walked in. So I have my patient here. I'll be changing the sheets. So you would want to grab a clean bath. It's called a bath sheet over the patient. You want to let the patient know everything you're doing. So in this case, I would be like, "Hi, I'll be placing a sheet over you, and I'll be removing the one under you. You want to make sure to remove the sheet under the person with a sheet over them, just to make sure to not expose the body. And you want to make sure to roll the sheets far away from you, so you don't want to come in contact with the uniform. And you'll dispose these in a lining bag that your agency provides you with. You then want to tell the patient that you'll be removing any contaminated sheets from under the person. So you'll let the patient know if they could help you roll over. But in this case, since I'll be touching the patient after I touch contaminated bed sheets, you want to go ahead and toss these gloves out and perform hand hygiene, and then you want to put on new clean gloves, because you don't want to touch the patient with dirty contaminated gloves. So once you've done that, you want to come with your clean gloves. You want to help the patient out on the side lying position. So you want to let the patient know if they could assist themselves, and if they can, well, you want to make sure you tell them to hold on very well to the side rail, and your side rail should be lowered. And then you want to help the patient move to the side, and you want to support the patient while they're doing this, and make sure their hand is on the rail for support. Very important. So now you want to go ahead. These are this is the dirty contaminated draw sheet. So you want to go ahead and roll it right under the patient. It's going to kind of be like a big bump right here. So you want to roll it and tuck it under the patient. So there's a fitted sheet right here as well. You want to go ahead and grab the fitted sheet and roll it under the patient, and make sure, like, while you're doing this, you want to explain the steps that you are doing to the patient just for comfort. You don't want, your patient to be wondering what could you be doing. You want to let them know exactly what you're doing. So you'll see how now I can see half of the mattress right here. So if the mattress is soiled or anything like that, if necessary, you want to go ahead and grab some sanitary wipes, or according to your agency cleaning policy, you want to go ahead, grab a wipe, sanitize the bed, the soiled bed, making sure it's nice and clean and ready for new sheets. So this right here is on the side. I'm gonna go ahead and toss these gloves out again and perform proper hand hygiene, because now you're gonna come in contact with the clean sheets. So let's say I already tossed out the dirty gloves and perform hand hygiene. I'll have my clean gloves back on. You're going to touch clean sheets now, so you don't want to touch clean sheets with contaminated gloves. So in this case, I do not have another sheet, so I will be using the same one as an example. So let's say I have my new clean sheet, okay? So you want to go ahead and grab your new fitted sheet, and then you want to tuck it on the corners of your bed as if you were making your bed. Like, for example, you make your bed at home with a fitted sheet. You want to make sure it's tucked in under the mattress very well. You want to make sure it's tucked in under the entire mattress. Keep in mind, in a hospital, you'll still have your contaminated sheet under the person, but tucked in. So when the person is rolled up to this side, you get to toss it out from the other side. So now I have my clean fitted sheet over the mattress. And now you want to go ahead and grab a clean draw sheet or a waterproof sheet. Some patients use both, or some patients only have a draw sheet, or sometimes only have a waterproof pad or sheet, So in this case, I use the same one. So you would want to technically go ahead and grab the draw sheet, put it under the patient, and the other half will be rolled against the back as well. So you will basically have your clean sheet over the mattress, tucked in under the person as well, but then the contaminated one is still under the person, but is rolled up against the person. So then, and then you'll have your clean fitted sheet right here. So then this is when you would want to tell the patient that you'll be rolling them back over to the other side, and you want to help them out and let them know that there's like a big bulge right here on their back because of all the blankets that are tucked in under the patient's back. So then you'll want to roll your patient over, making sure they're in good alignment and they're comfortable, and try to not expose the body like I said before. Now you want to tell the patient that you will be rolling them back to this side. And I can't show you what to do on the other side because of the circumstances, but I'll explain every single step. So now you will help the patient roll to this side and hold on to this side rail. So once the patient is rolled on this side, you want to always ask them, like, are they comfortable? Are there any pain? You don't want your patient to be uncomfortable at any moment. So once your patient is rolled on this side and holding onto the bed rail, this is where you get to grab those rolled contaminated sheets that you had, grab them and toss them out in a lining bag. And your clean sheets, remember, were still tucked under the patient. And then you'll want to roll them out, spread them out, and you'll want to put the fitted sheet on the other side of the mattress just like you did on this side, and you want to display the draw sheet or the waterproof pad under the patient very flat. Once you've done that, you want to help the patient in a supine position. So now my patient is sitting in a supine position. Now you want to go ahead and grab, this is called a bed sheet. So it's like more of a warmer sheet for the patient. So you want to display this evenly on the bed on the patient, making sure to get the feet, and you want to make it very even. You want to tuck the rest of the sheet under the bed so it does not touch the floor. So then it'll be tucked in the bed right here, leaving like a little triangle on the side right here. Now you want to make sure the patient's in good alignment as well. Now you'll be telling your patient that you'll be changing the pillowcase. So you'll want to support the head, get the pillow, and then your patient, let them know you'll be just changing the pillowcase. So when changing the pillowcase, you do not want to touch your uniform, like I said. So you will then remove the pillowcase, toss it in the lining bag. Then you want to grab your clean pillowcase. In this case, I'm using the same one, but real scenario, you need a brand new clean one, and you want to make sure. I know it's a habit for many people. Try your best. Don't try. Actually, I'm so sorry. You need to make sure you do not, by any chance, touch the pillow with your chin, teeth, nothing of your face. I know a lot of people have a habit of holding it with their chin. It's very unsanitary and is not proper to do so at your job. So you want to keep it professional. Keep it away from you. You want to put the new pillowcase over. The pillowcase over the pillow. Making sure to keep it away from your uniform. Once you put the pillowcase, you want to go ahead and get the patient back into a comfortable position. You'll raise the bed at a comfortable position, and you'll put the rail sides back up. Then you'll want to make like a little cuff on the beds, right on the sheets right here, making sure like the patient has his arms free out, and then you want to ask your patient, are they comfortable? Do they need anything? Do they want another pillow for support? You just want to make sure your patient is relaxed and comfortable now. If you can, you want to arrange the room now to a patient's liking. Remember the patient where the call light is at for if they need anything, an emergency or anything like that. And then you want to now remove your contaminated gloves without touching the contaminated gloves. And then you perform proper hand hygiene. And that is how you make an occupied bed. Thank you.